So this is a very interesting HRCT test of HRCT chest. Now, when we zoom in, what we can always try to see that in upper lung fields, this is the upper, this is trachea, and here the lungs are getting ended. So these are the upper air fields. What we can see, if we zoom in and if we can try to see, then this is the left side of the lung. Whereas we can see this is L means left and this is right. So the right lung is not at all visible. And the same thing here. The left side of the lung is seen and the right side is not able to visualize. If we can zoom in here, what we can see, there is significant difference between the lung quantity or lung volume. Just see there is significant amount of lung volume is here. But just compare this with the significantly reduced size of the lung on this right side. More is the lung, better is the oxygenation, better is the patient. But in here, there is significant difference of the lung size. Compare this it here also. If you can see, this all black is lung, which is significantly more in size compared to the lung on the right side. Just compare this size with this size. So lung the right lung, this is right, this is left. It is always this side is left and this side is right. It is written here also. This is R and this is L. So we always have to compare the left side with the right side, and we can see the comparison. Here, what other things we can say is, when you zoom in, we can see this is the left lung. Just see this left lung is so much large, whereas this right lung is so much small in size. Apart from the size, what we can see that this is the bone which we can see. Just see this is the bone which is in the midline. So the midline was supposed to be here in the middle. But what has happened here that this is the trachea. This black is all air. If you can see, this black is all air means this is the trachea. The trachea is not yet divided. The trachea is not yet divided. This is the trachea and it is not yet divided. And it should be in the center, like it should have been here, but it is completely shifted to the right side because there is pulling of the trachea towards the right side. That is the reason why the trachea is going to this side. It is not only trachea which is getting pulled on the right side, but it is all the mediastinum. The mediastinum structure. This is the mediastinum structure which contains the trachea and the heart. So the heart and the mediastinal structure is also is getting pulled towards the right side. So there is nothing on the right side which is there is nothing on the left side which is pushing it there, but it is all on the right side which is pulling the trachea and mediastinal structure on the right side. Just see it in here also. This is the midline. So this is the left portion of the mediastinum, and this is the right portion of the mediastinum. So significant amount of mediastinum is shifted towards the right side because of the fibrosis, and fibrosis always pulls the mediastinum or mediastinal structure towards the same side. So we must know that fibrosis, collapse, these things pulls the mediastinum trachea towards the same side. Apart from that, what we can see, this black structure, there is nothing inside this there is air inside this cavity. Also this, there is nothing inside this is the air. So basically there must have been some old infection in the right upper portion of the lung fields, which completely destroyed the bronchi, alveoli, and created a cavity. And that is the reason why there is a permanent cavity which is prone for recurrent infections. And the surrounding tissue got converted into the fibrotic strands, fibrotic tissue, and there is a loss of volume of this lung tissue. That is the reason why the right-sided lung is very small in size compared to the left lung. There is pulling of the mediastinum to the ipsilateral side, that is toward the right side. Apart from this, there are some few more findings which are there, which includes, if you can see in here, the normal lung should not have this many white streaks of lines. If you can see in here, these white streaks, there are so many white streaks. If you can see, these are the so many white streaks. These many white streaks are not supposed to be there. Ideally, as we know, from hilum, this is the hilum area, the bronchi, the bronchovascular markings should spread towards the periphery. So this should be the pattern of the bronchovascular markings. But what we see in here, there is accumulation of so many whitish fibrous streaks which are going toward this side, means there is an old damage of the lung parenchyma which has occurred. There is one more thing. If you see in here, this is the bone, this is the bone, this is rib. Basically this is also rib, which we can see. This is the bone, this is the vertebra, this is the vertebral body, this is the spine, and these are the transverse processes of the vertebral body. So we know that this is the lung margin, this is the lung margin. If you can see, this is the lung margin. So in the right side also, this is the lung margin which is there. So if we can see on the left side, there is no any lesion per se here, but if we can see, there is a dense white patch which is here. So this much of dense white patch in absence of a air bronchogram suggests old infective damage which is converted into fibrotic band. Because if it is an active patch or consolidation or infection, then it should show two things. Either it should show air bronchogram, and it should be a bit faint in the density, radio density. This is very, very dense white. This is as dense as you can compare it with the bone. Just compare this bone and this. So they are almost of similar radio density. It means this is not a infective patch. This looks a fibrotic band or fibrotic patch. The same fibrotic patches you can uh, follow here. That is the same patch which is getting followed in here. So this is a very interesting case where there is significant volume loss on the right side of the lung. There is a pulling of the mediastinum, pulling of the trachea. There is significant loss of volume on the right side, and there seems to be extensive bilateral pulmonary damage, so that the lung parenchyma appears a bit hazy in both the right as well as left lung field. That's all for today, and thank you for listening.